Olympic and pro beach volleyball player Brooke Sweat suffered a severe knee injury while practicing, but is now getting back to her Olympic dreams, thanks to a new outpatient procedure that uses a bioactive device called the S-Core. The FDA has cleared the device for use on patients with knee joint injuries.
I'm not exactly sure what I did when I injured my knee. The next day I woke up, it's a little more swollen, a little more painful. I'm just like, what's going on? I don't remember doing anything at practice.
Dr. Derek D., a board-certified orthopedic surgeon, diagnosed Brooke's knee as a severe injury to her knee joint, the bone and cartilage structure that provides stability, and when injured, can cause severe pain. The new bioactive implant is a new tool that allows surgeons to repair areas of the knee that cause pain, swelling, and instability.
Typical symptoms of an osteochondral injury are pain, swelling or stiffness, unstable or weak. It might want to give out on you or buckle. Inability to fully extend or bend your knee.
During an outpatient procedure that typically takes under an hour, Dr. D, who helped develop the new bioactive implant, inserts the implant that has been specially coated with bone growth ingredient that helps accelerate healing. Patients go home the same day as their procedure and begin their rehabilitation.
Recovery is going great. I'm going to come back being a better athlete, being stronger, competing at the level I want to compete at, and hopefully an Olympic medal.